Welcome, and I want to thank you for selecting this particular course to take. The idea here is that this is to be clinically relevant. It is to enhance your practice and enhance specifically the periodontal part of the therapy that you render on a daily basis to your patients. Of course, like any course you take, the concept here is it may validate the concepts and information that you use daily. It may contradict the information and how you interpret the evidence for certain therapies right now. Hopefully, it will provoke you to actually explore further different forms of periodontal therapy and deeper information that we can give in this particular seminar. As you can see, I'm a board-certified periodontist, and I do a significant amount of clinical practice. Although I'm a full-time academician, I do constant patient care. So this information is to be relevant to you, the practitioner, and the hygienist, and your whole periodontal team in your office to upgrade and render quality periodontal care for your patients. The clinical relevance of emerging trends in periodontics. We're going to look at the microbial approach to disease management. We're going to look at the changes in the concept of how the patient's host and immune system actually is part of the disease, and how maybe in certain situations it is more relevant to actually modify the patient's immune system response to the microbial challenge and actually try and change the microbial challenge. We're going to explore both the benefits of non-surgical therapy and surgical therapy and look at different mechanical approaches to this disease management. Regeneration is one of the raison d'etres of all surgery in clinical practice nowadays, and we're going to address the relevance of regenerative surgical therapy in disease management and how it can actually enhance your practice. There are evolving concepts in periodontics, so things have changed possibly when you went to dental school as far as actually the relationship to the disease as the patient's overall systemic health. However, the concept change here going forward is going to be that from a periodontal systemic health point of view, bleeding on probing is something that has to be addressed. Periodontal disease is not based on numbers. There's a non-metric component that's becoming more and more important to actually educate the patient about. And this has to do, once again, with the periodontal systemic link and other overall health issues from the periodontal problem, not just that the patient has a 5-millimeter pocket. Risk assessment, next big thing. So as I said, just by knowing the patient's age coming in gives you an idea about how in-depth you should actually evaluate for periodontal problems. Focusing on periodontal diseases as inflammatory reservoirs. This is a major change for many practices now. And it used to be just the pure concept that the only thing we're looking to control is the patient brush and floss, hopefully either control that gingival inflammation so it doesn't necessarily lead to periodontitis, or controlling their periodontitis with improved oral hygiene and improved maintenance as an end point of it in itself. But what we're finding now is that periodontal diseases are inflammatory reservoirs, and that is not just a very localized issue, but it has systemic ramifications. That bacteria will repopulate itself in that periodontal pocket and around that tooth and on that root surface in about 12 weeks. And that, once again, everything starts again, so that every 12 weeks your hygienist had to break up that biofilm before it matures to the point where it starts that whole inflammatory process again. Well, the changing concept is that because that biofilm is made up on patients who have periodontitis with very, very specific type bacteria, we know there are healthy organisms and there are pathogens. And the idea is to get the healthy organisms to populate that pocket. You can draw the patient's blood, and you can find antibodies to oral bacteria in that patient's blood serum. And there are different ways to test that. So this changing concept away to a much more global understanding that the patient's periodontitis has a major impact overall for that particular patient. And we talked about just moving away from just doing our hygiene instruction and our scaling and root planing, that there are other ways to actually combat this disease that you may want to roll into practice. That includes changing your... Now, Is the pathogenesis, though, the same for every single patient? You can't be a monotherapist, meaning that I don't believe in surgery, or you can't be someone who says, well, you know what, non-surgical therapy doesn't work, I always have to go to surgery. You have to realize there's a role for both. You have to be careful and think everything out and pick it for the right person and the right therapy that you want to provide. Recare. That reintroduction of recare, not necessarily to remove the biofilm, but to keep that patient's host response in an appropriate fashion. Well, does periodontal work? I put this in here because I do hear it from some colleagues. Because it's not cured, because it becomes hard to monitor, because you can't always see it, you can't see the results, because the disease goes through quiescent phases and exacerbates, and you can't always catch it. The question is, what's periodontal therapy actually doing? I want to thank those of you who have taken this seminar with me today. There's more info that you can ask online if you have any suggestions or any information. As I said at the very beginning, I hope I challenged you. If I just reaffirmed the way you've been thinking and taught, then great, so be it. If I've contradicted what you've thought and what you've approached and how you approach things, then I challenge you to go online and look for more information on a lot of stuff that we've talked about. Or finally, if I've created a new direction to actually understand that, you know what, periodontal therapy, once again, should remain a cornerstone of almost any form of dental practice,